Hey guys, it's been probably, I don't know, a while since I've done an update. So, the Klysiri I never did again. It was so painful. I honestly had no desire to do that again. Do I think it was probably good? Yeah. But things that are that painful, borderline excruciating, no thanks. But that doesn't mean that I don't have painful procedures and do other things. So, just to give an update, I have still been getting photodynamic therapy every 3 times a year. And when I do so, they make sure to cover my ears, all this. I do have quite a bit of sun damage here. This is just like acne scarring, right? You can see here, right? And she does my ears as well. But I really do have quite a bit of skin damage up in here. And, I have a brother that had a basal cell in that same area, so I'm really cautious about that area. But anyway, like right now I'm not wearing any face makeup, I'm just wearing lotion. We've been treating different spots. This one in particular, because it gets like little vascular type things, involvement. But we don't know exactly what it is. She thinks it might have been a precancer or just scar tissue underneath. Anyway, let me focus. Basically, I get PDT 3 times a year. I just found what was like a more rough spot. So this was just frozen here and same within here. So you'll see like I have some scabbing right now because she just froze that. She also froze just like a little thing here. So I am a little OCD. I do go in, and if I see something that feels a little bit rougher or anything that could look precancerous, I just have her do it. I don't care. I know it costs me. It's like $220 every time I get anything frozen. And I think you can get up to, I don't know, 7 or 10. I don't know what the rule is, but if you have 1 frozen, it's the same as getting up to like 7 frozen or 10 or whatever for the same price. So every time I go in, like every 3 months, if I see anything sketchy at all, I just have her freeze it. And because that slows the growth of whatever it is, or could kill it, depending on if it's still superficial. So just doing a quick update. I know my skin doesn't look that great, but I'm not wearing any face makeup because I try not to during the day, but I really do feel like I'm in a good spot just from the standpoint of I've been doing my PDTs and all the things. My dermatologist did ask me the other day if I wanted to do another Effudex, treatment. It's so painful, or just looks bad for a while. I probably will. I'll do that probably in December. Fluorouricil or Effudex, I can't remember which one she said now, but I will do one of those treatments in the winter when there's less daylight and when we go out less and when life slows down. So, there's always something. My dad has a couple basal cells they're treating right now. And looking at his skin scares me just because there's always so many things everywhere. I do get some definite stuff on my shoulders, kind of near my bra line that she keeps freezing, but just trying to keep up and always be watching. And that's really it. So I just wanted to give an update just because, kind of staying status quo. And just getting the photodynamic therapies, which again, they're super painful and awful. And it does take me, I don't know, it's like 6 to 10 days before you look totally normal and your skin's all not dry and sloughing off. But I'll take that over cancer. So that's where I'm at. So I hope everybody's well. Everyone's taking care. Sorry, this is not that informative. It's more just kind of what I'm up to because I am asked. I do get a comment a couple times a week on one of the different videos, whether it's Klysiri or just general what I'm doing for, maintenance of skin with living with skin, sun damage and whatnot. So, oh, there is one more thing I did. I do get some spider veins, and I have gotten 3 laser treatments, and my skin does look much better from that standpoint. So And the reason why I also want to do the laser is because when you get a basal cell, you'll see there's like little spidery veins leading up to it, like little vascular, like little just spider veins. And so I can't ever tell like what is an actual spider vein because I get them just genetically. Like a few here, you can see around my nose. So when I take care of those, it lets me not panic thinking I have a basal cell. So I'm trying to maintain the rosacea that I have. It's genetic. My grandmother had it. My mother had it. So that's what I'm doing. But yeah, so I have been doing the laser. It's not a BBL. It's a IPL. I did three sessions, and I'll probably do them again next year just because it does make your skin less red. And it also will show me when it'll be clear if I do get any basal cells or anything like that. That's it. That's all I got. So stay well, stay happy, and it's all going to work out.